As we continue our Primetime News series looking at the state of public health care, specifically whether a government policy to get people to use local centres more often than public hospitals is working, TVJ Shamela Mitchell has been following the story.
It is more working than it is not.
A Defiant Health Minister, Dr. Christopher Tufton, responding to concerns about whether the government's strategy to get people to use local health facilities instead of hospitals is working well. Defiant despite what we found out by visiting the facilities and talking to many people who say when they show up at clinics or community health centres, the services they need are not available. Even basic services such as dressings for wounds, which means they end up going to parish hospitals, which is exactly what the policy is supposed to avoid. But the health minister says if one takes a holistic look, one gets a different picture.
The reality is that if you examine in a more comprehensive way the role of these institutions and speak to the persons who work in these institutions, you will recognize that the institutions do more good for the communities that they reside in than what appears to be the case if you speak only to persons who have a difficulty.
But medical doctors do not quite agree with that assessment.
Those persons who are closer to the top in terms of administrators would probably agree with him, but those persons who are on the grounds working at the lower level might disagree with him on that, because for those persons working on the ground, what they see is a lot of daily frustration in terms of not having what they need to work with, and you know, this is something which is extremely frustrating for those persons who are working in the system.
Neither do the nurses agree.
Most persons who come to the hospitals, a lot of them come from minor things. They can do without coming there. The common colds and the this, and they will tell you that they can't get the drugs unless they go to the hospital. They're going to be able to get the drugs. They can't get X-rays. They can't get basic ECG. These are basic, and if the clinics can't provide that, then it makes no sense.
For MAJ President Dr. Smith, the situation should not be taken lightly. He says serious consideration should be given to fixing the problems affecting primary health care.
When it comes to health care, it's not really just health by numbers. So if there are 3 or 5 people out of 100 who have a bad experience, that's 3 or 5 people too many. And that is the reality, because for those 3 or 5 people, the bad experience can either be limb-threatening or life-threatening.
Meanwhile, Dr. Tufton says if there are issues, then the health ministry will investigate and address the issues.
It's a very complex issue, and again, what I say, we can't simplify the solution and just equate it to the fact that a health center doesn't have bandages.
Shamela Mitchell, TVJ News.